The medical method of psychology is the notion that mental illnesses can be attributed to things like biology or physical factors. This essentially treats mental illness like a physical illness, like a cold or flu. The medical method of psychology has led to a lot of advancements in how we treat and diagnose patients. I'll focus on the diagnostic part in this video. To a clinician, it's important to appropriately analyze the symptoms of their patient so they can give them an appropriate diagnostic. In order to keep this diagnostic system really consistent and rigid throughout the psychological community, clinicians can use the DSM-5 as a guide. The DSM-5 essentially gives lists of symptoms and the mental illnesses they're associated with so clinicians can accurately diagnose their patients. For example, in the DSM-5, in order to diagnose a child with ADHD, a criterion is that the symptoms or the behavior they're displaying would be considered inappropriate for their development level or their age. Now, it would be great if the DSM-5 was just some objective document that treats every patient perfectly, but this is not the case. The fact is that the DSM-5 is heavily influenced by Western culture, especially in the United States. The reason that this is a problem is that, for example, if diagnosing a child for ADHD because you consider the behavior inappropriate, it may be just that the behavior they're displaying is inappropriate for this specific culture, but is not actually harming the child in any way. This could lead to things like violations of conformity, leading to a diagnosis of a mental illness. This also eliminates a lot of the individualism that's associated with mental illness, and it ignores the spectrum that a lot of psychological distress exists on. It turns out that the consistency and rigidness of the DSM-5 is actually one of its biggest weaknesses. This also creates a lot of stigma around mental illness. For example, a study has shown that if a child knows that one of their playmates has been diagnosed with ADHD, that child is less likely to play with that child again. It also doesn't help that the DSM-5 has led to a lot more diagnostics of mental illness in recent decades. An alternative to this is the systems method of psychology, which gives a holistic review of the patient's life, looking at their environment and their relationships and how that could cause psychological distress. This is great because it actually caters to the needs of the patient, but it's a very complex process. And because the analysis of their environment is complex, necessarily the treatment has to be complex as well. This means that this isn't always an effective way of treating a patient. To more closely compare the medical and systems model of psychology, let's see how it would work on our hero Freddy when he's diagnosed with ADHD. Freddy is a normal boy, but he has some trouble paying attention in class. His teacher notices that he often daydreams, talks, and jokes with other students, frequently distracting them as well. Since this is a problem, the teacher suggests to Freddy's parents that he see a child psychologist. His parents follow her advice and they take him to a psychologist. Freddy's doctor prescribes him Ritalin, which is a stimulant, and it helps him pay better attention in class. Initially, after a couple weeks, Freddy's mood seems to improve. He's able to pay attention in class, and the drugs seem to be working. However, there's one thing that Freddy's psychologist ignored. Freddy experiences a lot of stress at home from his parents to be successful in school. This is probably part of the reason why he was so distracting to other students then. He just wanted to joke with them and have fun. Because the psychologist ignored this, Freddy became dependent on the stimulants to pay attention to school. His mood shifted, he lost motivation, he no longer enjoyed talking to his friends, and now all he has is a belly full of Ritalin. A better method would be for the psychologist to observe Freddy's environment holistically and see truly what's causing him to behave in the way that he does. You'll notice that this does not necessitate that the medical method is completely useless. The child psychologist can still use things like behavioral therapy and yes, prescription drugs, along with observing his environment to actually help Freddy and improve his learning situation at school. From this example, we can see that the medical method of psychology is most effective when it's actually married with the systems method. All the behavioral therapy and the prescription drugs that Freddy was taking became more effective once his environment was accounted for by a psychologist. It's also important to note that the systems method can't exist by itself. Studies have found that around 85% of diagnostics of ADHD are in fact due to biological factors, such as genetics. If this were to go untreated, studies have shown that children that do not face treatment for ADHD grow up to have complications like depression or even substance abuse.